So students, for selecting an antimicrobial agent, you must select those antimicrobial agents which are more economical. So for example, if you have different antimicrobial agents of same efficacy, among them you will select only those antimicrobial agents which are more economical. So let's take an example of methicillin resistant Staphylococcus aureus, that is MRSA. So for MRSA, we have different therapeutic agents which are available in the market like vancomycin, clindamycin, daptomycin, and linezolid. So among them, you must select only those agents which are more economical. Secondly, you will select the agent on your severity of the infection. For example, if your patient is suffering from severe infection, then definitely you will select only those agents which you can immediately give by IV, or the agents which have more efficacy. So if the patient is normal, in the sense that he do not have severe infection, then in that case you will select the agent which you can give him orally. So in hospitalized patient and in those patients who are suffering from the severe infection, you will give the IVs. While in case of hospitalized patients, those patients who are recovering and those who can take now the medication orally, for those patients you will move or switch to the oral medication, while the patients who are outdoor patients who are not suffering from the severe infection, you will definitely stick to the oral medications. So in case of MRSA, we have daptomycin, which is most expensive. Then we have linezolid, which is least expensive as compared to daptomycin. Then we have clindamycin, then vancomycin, then we have cefazolin. So among them, the most economical is cefazolin, but the most important and the drug which has most good efficacy is the vancomycin. So in case of the patients who are hospitalized, you will move towards vancomycin because we have proven results that this is the most effective drug. So among these, which are the agents which you can use orally and which are the agents which you can use by IV? So the examples of the oral agents which you can use for MRSA are clindamycin, linezolid, we have minocycline, then we have a double strength tablet of trimethoprim and sulfamethoxazole. Then in the case of parenteral agents, we have example of daptomycin, linezolid, and vancomycin. Here you can see that linezolid is available in oral dosage form and in parenteral dosage form as well. So in internet, we have different research articles on cost effectiveness of the drugs. So while writing an article, definitely you can write any article on cost effectiveness of the drugs which are used in case of MRSA. So what is MRSA? MRSA is definitely was discovered in 1961, but now it is resistant to methicillin, ampicillin, penicillin, and oxycillin. So this Staphylococcus aureus, this bacteria is actually resistant to methicillin. So we are calling it as MRSA. Now, what are the drug of choice? What is the first line treatment for MRSA? When you will research the articles on the internet, you will find that for severe infections like the bone or the joint infections, intravenous galactopeptides are the first choice for the treatment. Now, what are the examples of intravenous glycopeptides? These are vancomycin and teicoplanin. So what are the other drugs which you can use for this? As we have already discussed, examples include clindamycin, clotrimazole, and fluoroquinolones, and minocycline can also be used for MRSA. Now, in another research article, we have that we can use vancomycin and daptomycin as well for the treatment of MRSA as a first line treatment for MRSA. So what are the various sites which are affected by MRSA? So it can affect your skin, lungs, your urinary tract. Definitely it can infect the surgical wound or the bloodstreams. So now the conclusion is that the first line treatment for MRSA is galactopeptides and daptomycin. Among galactopeptides, we have example of vancomycin and teicoplanin. So this was all about the treatment of vancomycin. So in next lecture, we will discuss that what is antibiogram and what are the other factors which will affect the selection of the antimicrobial agents.